Yeah, Timothy, are you okay? Um, actually, I'm not okay. My aunt got COVID. COVID?
Yeah.
What is COVID? I don't know. What is COVID?
Malaysia has reported a jump in COVID-19 cases. 14 new patients have been diagnosed, bringing the country's total to 50.
Chronology of COVID-19. COVID-19 are known as SARS-CoV-2. It is widely believed to have originated in bats. The first reported cases of COVID-19 were linked to a seafood market in Wuhan, Hubei Province, China in December 2019. It's believed that the virus may have been transmitted from an animal to humans at this market, which also sold live animals including wildlife. So, how COVID first entered Malaysia? COVID-19 entered Malaysia primarily through imported cases via international travel, leading to subsequent community transmission within the country. Have you ever wondered what was the first ever case in Malaysia? The case, which involved 3 Chinese nationals from Wuhan, China, who had entered Malaysia for vacation, was confirmed on January 25, 2020. They were detected with symptoms of the virus and subsequently tested positive. This marked the beginning of the COVID-19 outbreak in Malaysia.
The most recent data of Malaysia active COVID-19 cases that has been recorded as far as the 22nd March of 2024. We have about 5,238,787 of local cases has been reported in Malaysia, with 39,142 cases is by imported cases. Currently, we have about 7,903 of active cases. About 99.1% of them is been home quarantine, about 7,833 patients, and 70 patients has been hospitalized. Fortunately, we have been recovered about 5,232,678 patients, and we have been recorded deaths about 37,348 patients.
Most people infected with COVID-19 will experience some symptoms with these common symptoms such as cough, fever, tiredness, and loss of taste or smell. There is also less common symptoms that will be experienced for certain people that under certain medical conditions such as red eyes, itches in brains, headache, and sore throat. Lastly, most severe symptoms can be observed at older people such as loss of speech or mobility. Did you call me Fazal? Yeah. Oh. And the other one is difficulty in breathing or shortness of breath.
So next, treatments of COVID-19. First, vaccine development. You must get vaccinated as soon as autumn and follow local guidance on vaccination. It is because being vaccinated makes us much less likely to get very sick compared to people who are unvaccinated or are not up to date on their vaccination. Second, contact healthcare provider. If you have COVID-19 symptoms such as fever, cough, and difficulty breathing, you can get tested and get a prescription. And then you should go to a pharmacy to receive medications. Third, remdesivir. It is antiviral medications which disrupts virus ability to replicate and spread within the body. It is specifically recommended for patients who have been hospitalized and require oxygen. And lastly, dexamethasone. It is a corticosteroid and a droplet makes adjustments to how immune system regulates itself. It is also can be used in patients who need oxygen and can be used in patients who are not on mechanical ventilation. Precautions of COVID-19. Firstly, avoid crowded places and unnecessary travel. We must minimize participation in large gathering events or crowded places, especially in areas with high transmission rates. Second, wash hands and maintain good personal hygiene. We should wash hands frequently with soap and water for at least 20 seconds, especially after being in public places or touching surfaces. Third, wear a mask properly. Make sure your mask covers your nose, mouth, and chin. And you must wear a good mask